Hello, everybody. This is Artie Bernaducci with the Retirement After 60 show. And today I have a guest that I think you will find very interesting. He's been a longtime friend, and he was the first acupuncturist licensed in the state of New Jersey a long time ago. And he was also the New Jersey State Board of Medical Examiners and the Acupuncture Examining Board chairman for over 22 years. He's been an acupuncturist for over 42 years. And back in the early days, I was one of his patients and have gone to him multiple times over the years. And so I wanted everybody who's never been to an acupuncturist to have an idea what the benefits of acupuncture is. And I couldn't think of anybody better than talking to Bob Lenahan. So welcome, Bob. How you doing?
How you doing, Art? Good to see
I'm
you
good.
again.
Good to see you too, pal.
Thank you for having me.
Oh, my pleasure. Thank you for joining us. So I've known you a long time, and I've always been interested in how you actually got interested in acupuncture and things like that. So give a little bit of background of where you went to school and how you started and what got you interested in acupuncture.
Sure. I was a pre-med biology major in college. Went to Boston College, graduated Bachelor of Science in Biology. My parents wanted me to be a dentist. I didn't want to be a dentist, okay? Years later, I found out why. My father wanted free dental work. So that was the truth there. I had an interest in Asian philosophy. I had taken martial art, Taekwondo, master instructor there with his outlook on life was very attractive, and I had an affinity towards the Chinese culture. I liked Chinese food. At that time, I knew how to use chopsticks early on. This was like around 1969, 70. And I think the Asian philosophy plus medicine, where I was headed, equaled Asian medicine.
Right.
The only problem back then was to find a place to actually study it, because there were no colleges of acupuncture in the United States, which is totally different than the landscape today. I was able to enter the New England School of Acupuncture, and I was in the first graduating class. And this was the first school in the United States. So that small school, is still in existence today. It's larger. It's actually been absorbed by the Massachusetts College of Pharmacy. And you can still apply and go there. After that, I went to England, to the International College of Oriental Medicine in Sussex, England. And I was there for 3 years. Mainly because the school in New England, in Boston, didn't have a large clinical program at the time. So I was afforded that in England since they had been established. And I came back, I interned with an old Chinese doctor in New York City and Chinatown, worked on the law to license acupuncture in New Jersey, and we successfully got it through the legislature. And back then, Governor Tom Keene signed it into law, and that established the Acupuncture Examining Board. And then we had to set up the testing, the requirements, all the rules and regulations of the profession. And here we are today, and New Jersey has probably close to 1,000 acupuncturists.
Wow.
That's
From
where we are.
all different levels of understanding, I'm sure. Bob, side note, just refresh my memory on something. There was a book that you and I talked about a long time ago, something, and it was tied to someone what teacher that you had in college, in England, something about the web or weaver.
Yeah.
Remember the book?
Yes.
What was that book called?
Yeah, the author is Ted Kapchuk.
That's it. Yes.
Now, Ted was the herbal teacher up at the New England School of Acupuncture. Okay. So what I didn't tell you is once I came to England, I went back up to Boston every Friday to study with Ted Chinese herbal medicine. Okay. He wrote the book, The Web That Has No Weaver.
That's the
and
one.
Ted, I believe, is currently teaching at Harvard. He teaches courses, amongst other, about placebo effect. And that has nothing to do with acupuncture because it's not a placebo. But Ted, spoke Chinese and translated many materials early on when there was really no literature available at that time.
Mm, interesting. Very interesting. So I know that acupuncture has a history of like 2000 years and stuff, and like the latest 40 or so years, it's gained some popularity in America. Why don't you give us an explanation about what acupuncture is?
Many people are familiar with it today, far more than, way back in the late 70s, early 70s even. Acupuncture is part of Chinese medicine. You can almost divide Chinese medicine into acupuncture and herbal medicine. Most acupuncturists know herbs to a degree, and most herbalists know acupuncture to a degree.
Okay.
There is a very close link between those two categories of Chinese medicine, and that's mainly, I would say, in the diagnostic skills. There's something called the pulse diagnosis,
Yep.
which we utilize to understand the inner workings of the individual. This is my pulse pillow here. If
I know it
you
well.
can see that.
I know it well.
Okay. So palpate the radial artery, and in 3 positions, there's 28 different pulse characteristics. Some people fall between the cracks of those 28. That gives us a view inside the body. And we can transpose that to a prescription of acupuncture points, a prescription of Chinese herbal medicine, in order to help balance the body.
Fascinating. It really is. So when you actually do the needle, because nobody likes to get stuck with needles, when you actually put needles in the body is like, I'm not afraid of needles, but some people are. To allay the fear of that, can you explain the difference between going to get get blood taken out of your body and also getting an acupuncture needle?
Yeah. For the most part, the hypodermic needle, you feel much more than an acupuncture needle. An acupuncture needle isn't hollow, so you can make it very fine. And it doesn't have the beveled edge, the razor edge that a hypodermic needle. It actually comes to a point. So most people barely feel any part of the needle insertion. We treat children, and we've had many children sit on their mom or dad's lap. I'm talking about even down to an infant. And sometimes they'll just watch you do it, observe it without a reaction.
Mhm.
So, children can do it, adults can do it, and it's minimally invasive.
I remember some years ago when you cooperated with me on a video that I was doing with getting people to come to this event, and we were saying I had 100 needles in me. I actually had like 60 needles in me, and I didn't even remember feeling any of it going in. So, so when you put the needle in, you're trying to stimulate the nerves for the body to release some kind of hormones or whatever the case may be, I guess. Clarify if I'm wrong, but just from the standpoint of that stimulation of the electrical system in the body, what's the purpose of that? What's the basic reason to do that?
Okay, first of all, anybody listening to this, we don't usually put 60 needles in anyone. Artie is a special case. There's only a few. And in children, by the way, they only do like 2 or 3 points on the arm, or 1 or 2 or 3 points on the leg. The average person hardly has anything near that number. As a matter of fact, we use a minimal amount of acupuncture points. And I always tell a person that I choose the fewest, most effective points.
Okay.
So that prescription, which is determined the first day in the diagnosis, is what we apply and reapply. Acupuncture is dynamic. So if anything pops up during the course of treatment, we can amend that prescription to address those problems also.
Very interesting. It's like
Now, I don't think I totally answered the question because we got sidetracked on the amount of needles. But what acupuncture does, you mentioned the nervous system. The Chinese describe what was called qi, and qi is sort of the functions of our body. And that's what acupuncture stimulates, is the qi. So the best way to visualize that is by bodily functions. So for instance, respiration. is an expression of qi. Your body warmth. You know, a lot of people as they get older, they get colder, especially women. That's a deficiency of qi. Your ability to move around, put your body in motion. Older people walk a lot slower than younger people, another expression of qi. Your digestion. When you chew and swallow something, it just doesn't go all the way down and out. It goes along and it stops at various places in your body where your body's qi works on it in order to absorb the nutrition. Your defensive energy, which everybody today is very big on talking about the immune system. So your ability to ward off, you know, disease that may penetrate your body in many different forms. It could be from a simple cold to a virus. Your ability to hold things in place. All your organs, believe it or not, are held in place. People get hernias or they get prolapses where things fall down and out of place. That's another expression of qi. And that's what acupuncture does. Acupuncture is a tonic for the qi. So of all those different bodily functions, that's what we address. And Western medicine, as good as it is in crisis management, et cetera, it doesn't really have many tonics for the qi. You know, they may give you steroids, but that's a false tonic that you can't stay on for a long period of time. Maybe a vitamin B12 shot, a little bit of a blood tonic. But Chinese medicine, including Chinese herbology, has many, many different blood tonics, many other Chinese herbs and acupuncture prescriptions to help the qi of the body.
It's fascinating to me. Like there's a lot of, I remember you telling me like there's a lot of different expressions of qi when you do the pulse diagnosis. Like I don't remember some of the terms you use. One that comes to mind is like something feels heavy, or you have like that was in the 28 things that you said before, right?
Yeah, 28 different pulse qualities. So
That's
when
it.
we palpate pulse on the radial artery, we're not just counting the beat according to a clock. We're
Right.
putting a blood pressure cuff on you to
Mhm.
get, you know, how many millimeters of mercury it can move or whatever. It's far more perceptive than that. And one of the abilities of the pulse diagnosis is to express what's going on inside your body, maybe even before there are symptoms. So you can address in a preventative way illness as well, not just in the acute stages.
Which is a big different than American, you know, than the regular medicine. And one of the questions that I've heard people when I've dialogued about it is they really want to know is it worth getting stuck with needles to feel better? Has anyone ever asked you that question?
You know, we have a lot of patients, many of them, I see a lot of elderly patients and young people who are stressed out and different, you know, physical maladies. Maybe they hurt themselves surfing or in gymnastics or something like that. But elderly people, you know, as the gas is running out of their tank and different maladies are coming to the foreground that they can't sleep off anymore. So it's definitely worth it to them because it's drugless. They're not going to have any of the side effects, which, you know, can cause problems in and of themselves. It's simple medicine. It's not complicated, you know, and so benefits always outweigh the part about having the acupuncture performed. Many people fall asleep during treatment. And when they go back and tell their friends, when they ask them, how was it? Oh, I fell asleep. The people are like, what? You fell asleep with needles in you? How could you do that? It's very relaxing.
Yes,
Releasing a lot of stress in the body. And that's a very common effect.